The top 10 riskiest forms of eating disorders. Eating disorders are the term used to describe aberrant or disturbed eating patterns. Dietary issues. These detrimental actions can be the result of several circumstances. Eating disorders are typically caused by a fixation with food, body image, or weight. These conditions frequently have detrimental impacts on health. In rare circumstances, they can even be fatal. Eating disorders can be caused by a variety of variables, such as brain biology, personality, societal norms, and, in certain situations, heredity. Eating disorders can affect anyone, regardless of age or gender. However, young women and adolescents are more prone to develop them. Up to the age of 20, 13% of young individuals may suffer from one or more eating disorders. The most dangerous eating disorders are listed here, along with the grave outcomes they may cause. The 10th item is night eating syndrome. Evening eating disorder. The prevalence of this illness is equal in men and women. Though less well known than others, it happens frequently enough to be noticed. In other words, those who suffer from this illness eat during the night. To eat when they are not noticed, they may conceal food. They can also have a history of substance misuse or be overweight. Diabetes, elevated blood pressure, and excessive cholesterol can result from night eating syndrome. Numerous individuals with this illness are also diagnosed with depression and various sleep disorders. Many of them also suffer from anxiety, which can make their nighttime eating habit worse. The fact that this condition frequently appears in people after they have not been able to follow a diet is very intriguing. These patients restrict their caloric intake during the day in an effort to reduce weight. But at night, hunger takes over and forces them to replenish the calories they have missed. Nocturnal sleep eating disorder is number 9. Night eating disorder nocturnal. Individuals who have this illness physically get out of bed in the middle of the night and eat, frequently in excess. The fact that the majority of sufferers are unable to recall ever eating or getting out of bed is one fairly unusual feature of this illness. Even those who are aware of their nocturnal behavior are powerless to stop it on their own. In that it can be rather challenging to wake someone who is sleep eating. This disorder is quite similar to sleepwalking. People may exhibit significantly altered eating behaviors from their typical eating patterns during a sleep eating event. For instance, they might consume things that they typically only consume in conjunction with other foods. Jam, butter, and sugar are a few instances. Those who sleep eat tend to consume foods heavy in calories, particularly those that are sweet. These people often gain weight as a result of the extra calories. There are other risks. Sleep eaters may inadvertently consume inedibles or mix meals in harmful ways. 8th. Pregorexia. Priororgia. Some expectant mothers take steps to control or prevent their weight, usually in an effort to avoid acquiring too much weight. Pregorexia is a term used to describe behaviors and symptoms that are comparable to those of eating disorders in other people during pregnancy. Women who are pregnant and more concerned with their weight than their health frequently overwork themselves. A fact, what one woman deems excessive, may not be the same for another due to differences in their physiques and states of health. On the other hand, women who train till they pass out are acting excessively. The fact that a woman's eating habits may be impacted by her fixation with weight could exacerbate the situation. She runs the risk of jeopardizing the unborn child's health if she consumes too little calories. This may lead to growth retardation, low birth weight, and potentially severe birth abnormalities. 7th. Bigorexia. Largorexia. Bigorexia is a type of body dysmorphic condition that is also referred to as muscle dysmorphia. People who believe their body is too little or skinny, not enough muscled or slim, experience this. Though some girls also suffer from this illness, males exhibit this kind of conduct most frequently. These individuals perceive flaws in their physical appearance that are actually not flaws at all. Additionally, they could spend hours examining their bodies in the mirror and become fixated on a small flaw. Bigorexia sufferers do rituals and repetitive tasks designed to gain more muscular mass. It's interesting to note that rather than flaunting their honed physique, people with this disease frequently conceal it under baggy clothing. This is due to their belief that everyone may see the bodily defects they are fixated on. Eating habits are frequently impacted by a fixation with one's physique, even though this condition encompasses other behaviors as well. Sufferers may insist on eating particular foods in an attempt to reach or maintain their ideal weight. These individuals are usually erratic in their eating habits, obsessing over their diet for the most of the day. Many of them will go overboard with their diets in an attempt to reduce body fat or develop muscle mass. They could also start using steroids. In actuality, a strong sense of inadequacy is the root cause of this condition. Their relationships with others and other aspects of their lives may suffer as a result of this low sense of self-worth. Avoidant restrictive food intake disorder is number 6. Foods to avoid and restrict inhaled disease. What was formerly referred to as selective eating disorder has a new nomenclature. Previously, only children aged 7 and under were diagnosed with this disease. This disease is equally frequent in men and women, and while it typically first appears in infants or early childhood, it can also last into maturity. A common symptom of this condition is a dislike of particular tastes, scents, colors, textures, or temperatures. It's also possible that they're just not hungry. A substantial degree of weight loss is common among sufferers, which increases the risk of nutritional inadequacies. They may also have detrimental effects on their psychological well-being and become dependent on dietary supplements to be healthy. The 5th is orthorexia nervosa. Nervosa orthorexia. Those who have an obsession with eating only clean, healthful meals fit the description of this illness. These foods frequently consist of organic or health store items. This disorder causes its sufferers to become obsessive over what they eat, how much they consume, and how it is cooked. They can become so consumed with following the perfect diet plan that they would even punish themselves if they stray from it. One possible type of punishment could be fasting or an even tighter diet. This disorder can be especially hazardous because of this fixation with healthy foods. In fact, it has the power to take over a victim's life and paralyze them. This incessant obsession with eating has the potential to rob joy from life. For someone with orthorexia nervosa, everything else, including connections with friends and family, job, and school, takes a backseat. Some people even go so far as to experience potentially fatal levels of malnourishment. The 4th is bulimia nervosa. Individuals with this illness are classified by bulimia nervosa as either purging bulimics. Nervosa bulimia either non-purging, purging, or non-purging bulimics. To get rid of the calories after eating a lot, the former will induce vomiting or utilize other purging techniques, while the latter would overdo their activity. There are numerous causes of bulimia. These include an infatuation with one's physical appearance or weight, a want to eat till one is uncomfortable, and a dread of gaining weight. There is much more to bulimia than binging and purging. In between their binges, bulimics frequently follow rigorous diets, misuse laxatives, and employ herbal weight loss remedies. Even though eating disorders like this one can have horrifying outcomes, their sufferers usually believe that their actions will go unpunished. Potential issues linked to bulimia include severe teeth damage from the stomach acid in vomit, addiction to laxatives, kidney failure from excessive dehydration, and digestive issues. Some people may experience erratic heartbeats and pass away from heart failure. Periods can also be missed by females. The 3rd is anorexia nervosa. Nervosa anorexia. Because victims of this eating disorder often become startlingly thin, it usually garners the greatest attention from the media. This has specifically affected a number of well-known performers, whose images give the media exciting narratives. Individuals with anorexia feel driven to severely restrict their calorie intake in order to shed as much weight as possible. Even though anorexics are often taller than 5 feet, in certain circumstances they weigh less than 100 pounds. However, not all of the victims are visibly underweight. Furthermore, not all of them are female, despite what is frequently depicted in the media. Furthermore, they don't just engage in drastic dieting. Some anorexics exhibit behaviors similar to those of bulimics. They might, as is typical with bulimics, choose to purge themselves. They could also have some peculiar habits. For instance, some people prefer not to eat with other people. Some people use excessive doses of diet medications because they are so obsessed with losing weight. Even though the weight loss is just their own body fluids, some will even take diuretics to reduce their weight. Health issues brought on by anorexia can be just as serious as those brought on by bulimia. One of these consequences is a drop in white blood cell count, which impairs immunity and makes patients more prone to illness on a regular basis. In addition, malnourishment, tooth decay, thyroid issues, and seizures can befall anorexics. Women frequently experience irregular menstruation. Low blood potassium can also be caused by anorexia. Given that it may result in major cardiac issues, this poses an especially serious risk to one's health. Binge eating disorder is number 2. Disorder of binge eating. This condition shares many symptoms with bulimia or anorexia. It is normal for sufferers to consume huge amounts of food quickly. When they binge, they typically feel powerless to stop eating. Unlike those with other eating disorders, binge eaters do not make up for their overindulgence by restricting their caloric intake, purging, or engaging in excessive physical activity. After they overindulge, they feel ashamed of themselves. Ironically, regardless of whether they are hungry or not, these emotions frequently lead them to binge again. Because they usually binge when they're by themselves, bingeers can seem completely normal to outsiders. However, this practice can lead to a number of extremely significant health issues, including as diabetes, kidney disease, and heart failure. Naturally, a large number of them develop obesity, which can also result in other health issues. First on the list, eating disorder not otherwise listed. Not else specified eating disorder. While some persons may not exhibit all the behaviors required to make a specific diagnosis, they may exhibit behaviors that are diagnostic of several different eating disorders. The diagnosis of eating disorder not otherwise specified is subsequently given to these people. However, there isn't much this diagnosis can do to help with treatment. In the absence of a more precise diagnosis, individuals may experience feelings of helplessness and uncertainty about the validity of their condition. It may be quite challenging for them to receive appropriate therapy because of this and the fact that many of them appear completely normal. A person suffering from anorexia may also engage in purging activities, which are typically linked with bulimia, in addition to excessive calorie restriction. Despite being somewhat nebulous, this condition can seriously endanger a person's health. The repercussions might potentially be fatal. Threatening life. Even while eating disorders affect a lot of people, they continue to carry a stigma. Misconceptions. This is bad since it can give rise to misperceptions. Because the effects of these kinds are not just physical but also psychological, this list can be very helpful in identifying the most harmful kinds. Anyone who thinks they could be suffering from an eating disorder ought to see a qualified medical practitioner. Agree, mention, and share. Please like and share this video with your friends if you think it's helpful so we may continue to make more of them. Click the subscribe button and don't forget to click the notification bell for more videos just like this one. Don't forget to watch our other videos as well. Thank you for viewing.